the start of the pandemic, there has been several issues of misinformation that the world has had to contend with, while still in search for a vaccine for the novel coronavirus. Scientists have warned that the coronavirus is spread through droplets from an infected person when he coughs, speaks or sneezes, and says the only way to reduce one's chance of catching the virus and possibly reducing its spread is to observe a safe distance and always wear a face mask. But the number of infected cases continue to soar, while COVID response adopted by several countries around the globe is yet to flatten the curve of transmission. Well, here's a breakdown on the number of coronavirus infections today. Globally, infection rate has now reached at least 17 million mark. Nearly 670,000 have died, while about 10 million have recovered. While cases in the United States is nearing 4.5 million as it remains the epicenter of the global pandemic. Brazil has recorded 2.6 million cases, while the cases in India has reached 1.6 million. Russia is fourth on the list of top countries with the most infections recording about 838,000, and South Africa has reported about 482,000 confirmed cases of coronavirus. Well, back home, cases in Nigeria has reached 42,000 infections, while about 19,000 have recovered from the disease. But sadly, about 878 were not so lucky. This is COVID-19 Myths and Facts. I am Esther Mokwariola. Welcome on board. Well, as we battle this global health crisis, one of the issues has become a major concern: cybersecurity. The World Health Organization is asking everyone to be wary of misinformation, circulating on some social media platforms that the organization is given job offers for a certain amount.
According to the global health body, hackers and cyber scammers are taking advantage of the coronavirus disease by sending fraudulent email and WhatsApp messages that attempt to trick one into clicking on malicious links or opening attachments. These actions can reveal your username and password, which can be used to steal money or sensitive information. In the light of these concerns, the World Health Organization has dissociated itself from any fraudulent offer and said it will never do any of these. Ask for your username or password to access safety information, email attachments you didn't ask for, charge money to apply for a job, register for a conference or reserve a hotel, conduct lotteries or offer prizes, grants, certificates or funding through email. Be on alert when you receive an email with any link or attachment containing any reference to the WHO. It might be a cyber attack.
Now, according to Somalia's official figures, fewer than 100 people have died of coronavirus. But a recent investigative report showed that the cemeteries are filling up fast in the country, and not many are willing to report any symptoms of COVID-19 to the state authorities out of fear that they may die once in the isolation centers. And to further worsen the scenario, adherence to safety guidelines in the country is at an all-time low. Some are even hopeful that the virus will not do them any harm.
طبعا أمضوا وأمض إسلام ونبهن دعوين كان سيدان أو كلام ركي دعان أما أي مهدان طبعا وما شاء الله عررايو وبيت الله وجرج الله
والله إني عذر كان هرتواجرة لكن نكى إلى وطلع وقدع مثلا أنا عند ضد مسلمنا مساعد كمان مرنا وتكنينا باورت أسرعنا وشاهد لعبينا فهمت وحي إلى قفك إلى وطلع وقدع بس قفك لكم مدعي كرادة أساسا أمي سنة
Well, joining me to bring more perspectives on this investigative story is a BBC journalist, Jamal Usman. Good to have you on the program this evening, Jamal. So let's begin with this. What informed your decision into delving in this story?
Obviously, I am a Somali, and I'm always interested in what's happening in my country, and I follow it very closely. So, we wanted to do a documentary about what is happening in the only designated hospital in the country, the only designated COVID-19 hospital in Somalia, which is called Martini. And we realized that what was happening in the hospital and what we were hearing outside the hospital were not the same. So we started investigating, and we started with the cemeteries. We visited few cemeteries in Mogadishu, few main cemeteries, and we focused on one called Barakat. And the cemetery managers and the grave diggers told us that the number of bodies they are burying, they have been burying in the last couple of months, have really gone up. And they have a good system where they record every body that they bury. So they told us in that past 4 months they buried 2,000 plus bodies. And then we asked them what were the symptoms, or people were saying the reason of death, and most of them said lack of breathing and temperature, COVID-19 symptoms again. And then we looked at satellite images and actually found this place was an empty land in January. And now you have 2,000 plus bodies. So that is how we started. And then we looked at the four main districts that most bodies were coming from, talked to neighbors and what have you. Then local mosques, because in Muslim countries, when someone dies, they are normally taken to the mosque to pray over. So we visited 19 mosques in that particular district, and they told us again the number of sort of bodies they prayed over have really gone up. Some said they used to pray over on average 5 to 8 bodies a month, and now 40, 60. One mosque said 90 in the last month. Again, we went to private hospitals where normally people go to. They told us similar stories. And actually, the Mogadishu mayor said at the end of April, in the last 10 days, about 500 bodies were buried. So even within official sort of figures or government, there were some huge discrepancies. And that's how we tried to find out the true number of people who died with COVID-19 symptoms.
Indeed. So from all that you've said now, how much of these findings were you able to gather, and to what extent do you think this will in any way affect the figures often released by the country's health authority, do you think?
I don't think the government would want to add any more numbers, because they are only counting, especially in Mogadishu, those who die in Martini Hospital. So they are not counting people who are dying outside the hospital. They have added few figures from other parts of Somalia, but mostly from the Martini Hospital. So I don't think it would have any impact on the government, because they remember, Somalia, we have had a long civil war, so we might have a government on paper, but it's not a functioning authority that can do what a government is expected to do. So I think they are not going to change the figures, but that is the actual number, I would say. I would say thousands of people in Mogadishu alone died with COVID-19 symptoms.
Staggering, I would believe. But from this investigative report, it also showed that there was a total disregard for safety guidelines. So how far do you think there has been a change so far to this approach, or are things remaining the same? What can you tell us about this?
Yes, some people are taking it a bit more seriously, but I will say the majority of the population, even when the government was telling them social distance, please, curfews, don't gather to certain places, people completely ignored. And during our filming, and even from the moment COVID-19 was declared in Somalia, people were going on about their daily lives. Mosques were full as usual, markets were full, public transport. Anyway, so people did not take into account what the government was saying. And I also think there was a gap between the government's message and the public. They were mostly sort of targeting in English and social media, where most Somalis don't follow social media and don't have internet access. Their main medium of communication or information is radio. So I think there was also a gap from the government side, that they targeted the wrong sort of medium, I think.
So if you are to give us, briefly, what do you think the government needs to do to address these COVID-19 response for the Somalis?
The government needs to do, we have a system as every society. You have religious figures who are very powerful, those who run mosques. You have business community who run businesses. You have clan elders. Somalia is a clan-based society. So I think if they convince the business community, the religious community, and the clan elders, people listen to these people. They don't necessarily trust the government because we haven't had a functioning government for many years. And even interestingly, you would expect when people get sick to go to the hospital. Even that particular Martini is labeled as the hospital of death. So people even avoid the hospital unless they have relatives who are well informed. So I think the government needs to focus on the local people and talk to religious figures, business community, and clan elders to influence the society.
All right, and that's a fine place to leave it. BBC journalist Jamal Osman, it's a pleasure to have your insights onto the show tonight. And that's all for today's episode of COVID-19 Myths and Facts. Remember, whatever you do, stay informed and stay safe. Until the next one again, I am Esther Mopariola. Bye for now.